Well, today in Helena, the public weighed in on the proposed updated rules for Montana's medical marijuana system.
As MTN's Jonathan Ambarian reports, a number of marijuana providers voiced their concerns.
On Thursday, several dozen people were on hand in Helena to weigh in on proposed changes to the administrative rules for the Montana medical marijuana program. The Montana Department of Public Health and Human Services says the changes are needed to implement a new medical marijuana law the legislature passed last year. They include overhauling the fee structure and introducing a license structure based on providers' growing space.
The proposed rules seek to continue to strengthen the integrity of the medical marijuana program, as well as implement changes required by law.
But several provisions in the rule proposals drew criticism from those in attendance. One is a prohibition on posting any public information that a reasonable person would believe identified marijuana products or prices. Providers said the rule is too broad and will make it difficult for patients to make informed decisions.
Where people are actively looking and searching for information, they should be able to do that, and we should be able to, as providers, put that information available to the public.
Another contentious change would limit providers to selling CBD products from Montana hemp growers. DPHHS says the rule will ensure CBD products are safe, but providers say it's an unnecessary barrier for their patients.
The CBD products that come in from out of state are federally legal, they're federally tested, and they don't deserve to even be listed in this act. Okay? This is another example of policy being created for some unknown reason that no one can even understand.
Some commenters also had concerns about how the department will determine the limit for how much of a marijuana edible or other product a patient can possess. DPHHS will continue taking comments on the proposed rules through February 28th. Leaders say they'll take everything they hear into consideration before finalizing the rule changes. In Helena, Jonathan Ambarian, MTN News.
Now, one of the biggest changes in the most recent law is untethering patients so they don't have to choose a single marijuana provider.
DPHHS leaders say they've been waiting to implement that until the state's tracking system can show whether a patient has bought more than a daily or monthly limit, and that could happen by the end of April.